Hi, I'm Madeline with Blue Medical. Today I'm going to demonstrate how to administer a subcutaneous or SubQ injection, which is an injection that goes just below the skin. Step 1 is to gather your supplies. First, make sure that you have your prescription or your welcome packet handy so that you know what dose you're going to administer. Then you'll gather your supplies by getting your solution of medication, 2 alcohol prep pads, your subcutaneous syringe, and a cotton ball in case there's a little bit of blood. Step 2 is to draw up the medication. You're first going to start by washing your hands so that they're clean. Then you're going to take your solution and remove the cap from the top. You can discard this because you won't be needing it again. Then you'll take an alcohol prep pad and you'll clean the top of the rubber membrane each time before you give yourself a shot. Then you're going to remove the cap from the syringe and be careful that the needle doesn't touch anything. If you're going to inject, say you're going to do 30 units, you're going to draw up 30 units of air or whatever the amount that you're going to be injecting. Then turn the needle upside down and inject the air into the vial. Then you'll tip the medication upside down and pull back the amount of medication you're going to give. So I'm going to pull it back to 30 units. In fact, I'm going to go a little bit past the 30 units. And then once I see that the medication's filled, I'm going to push the plunger back up until the top of the black part is right at 30 units, making sure that there's no air bubbles. Then you flip it back upright, carefully remove the needle, and then you can again check, and if there's any air bubbles, you can just push a little bit of the solution out the top. Then you're going to carefully recap the needle so that you can prepare for your injection. Step 3 is to administer the medication. This medication should be administered in the abdomen at least 2 inches away from the belly button. Also make sure that you're not injecting it in any areas that are bruised, have a scar, or any skin rashes. First, you're going to want to prep the site by taking your alcohol prep pad. We're going to use this lemon for a demonstration. You're going to start in the center and move your way out to clean the area. Make sure that it dries completely before doing your injection. Then again, uncap your syringe by pulling it away like this. Using your non-dominant hand, you're going to slightly pinch the area of skin where you're going to inject, and then using your dominant hand, just insert the needle at about a 45-degree angle and slowly push the medication in. Once the medication is in, pull the needle directly out. You're going to recap your needle. And if there is a little bit of blood, that's what your cotton ball is for, so you can apply pressure for a few seconds. Once you're done, just make sure that you dispose of your needle properly. And that's all there is to it.